All right, my people. Yeah, we had a lot of glitches, so I was trying to set up the live show. That is why. Yeah, I hope everybody can see me now. Hello, everyone. I greet you all. This is Samuel Ogunbode, and I am your friend, and I appreciate you for coming with me to this live show. All right, if you can see from my description, I put it right there that you might be an instrument. You might be an accessory to helping someone going under the ground without knowing. Yeah, it happens a lot. I've seen a lot, and I'm speaking from first hand experience, not what I was told. This is not history, it's what I saw, it's what happened, and it's still happening in 2026. That is so sad. So you see people coming to the hospital, and then uh, you tell them that this person, this your family member, is not to eat anything, it's not to take anything by mouth. There is a reason for that. And we see family members sneaking in and giving these people things to drink or to eat. It happens. There are reasons for that. And we're going to get to that point. We're going to get to that actual reason as we move along in this video. Let me quickly take us back to about 15 years ago, 15, 16 years ago. That was 2010. So a woman came to the hospital carrying her baby in her hand. She was crying. She was sobbing so bitterly, and she was shouting for help. She was really crying. And then we took the child and we assessed that child. Unfortunately, that child was already gone after assessment. But you can't just assume that. You still need to try to resuscitate the child. So as we were resuscitating this child, we try to compress. The more we compress this child, the more we saw a lot of things coming out from this child's mouth and from the nostrils as well. So as we're seeing all these drainages coming out, offensive odor, of course, could be some herbal substances that they were giving to this child. That child was under age 1 at that time. So then we're trying to ask them, what did you give? What happened? Then they try to explain what happened. Apparently, that child was convulsing, and they were trying to give this child something to drink, a medicine. And in that process, the child aspirated some of those contents, which impede gas exchange in his lungs, and that caused a lot of trouble. So the boy became asphyxiated, lost the ability to breathe, and eventually they wasted time trying to do things or the other at home so that nobody would blame them for what happened. They were so scared that, oh, if we get to the hospital, they might see these things, this child must not die. So they wasted a lot of time. And by the time they came to the hospital, it was too late, unfortunately. Unfortunately. So, oh, it was a tough experience. I can't forget. So we just have to explain to them, sat them down and told them what really happened. And I believe that must have been a life experience for them. But sadly, the more we do health education, the more we do health talks, we reorient people, we tell people about dangers of giving someone who is unconscious something by mouth. We still see these things still happening in this era, at this age, this century. We still see things happening. So I will quickly talk about management of unconscious patients or someone who is convulsing, someone who is not awake, who is not alert. So people don't know that when someone is unresponsive or they are convulsing or they actually or they fainted, they are unconscious, they do not know that that is different from when this person is awake, alert, oriented, knows what is happening in his environment, can control things by himself or herself. They do not know the difference. And when someone is unconscious, we need to know that they don't know what is happening in their environment. They cannot control or protect their airway. So these people, the rule of game is do not give them anything by mouth. If you give them anything by mouth, instead of that substance to go into their GI system, into their stomach, it will go, or let me say, it may go into their airway. And it is very important to protect the airway of an unconscious person. So, whenever you have any family member or you witness an event where someone is unconscious, or they brought someone to you that, please, do you have anything to do? I know a lot of people will try to be like they want to help. They want to help, but when you try to help, know what you are doing. Never give anything by mouth to anyone who is unconscious, who cannot protect their airway, because they may aspirate from that, and the degree of that aspiration, if it's beyond very minute portion, it could lead to something that we have no control over, eventual death. So please and please and please, whenever you see someone who is convulsing, do not give them anything by mouth. They may aspirate from it. Someone who is not responding to you when you call them, you tap them, please don't say you have to give them medicine. You are putting it in their mouth. That could go into their airway. Please and please let us note that. That is one thing. Another experience I would like to share with you goes this way. There is a man who actually visited the hospital because he was feeling some funny symptoms. That is the way he described it. When he came, he said, I was having some of these funny symptoms. I feel like I'm having some headache. I just don't feel well. So this man was screened and everything done. Eventually, his blood pressure was elevated. So high. And he was stabilized. Eventually, he got discharged from the hospital with prescription medications. So he went to the pharmacy and he got those medications. And of course, he has follow-up appointment that was set up for him. So he was grateful for every services rendered to him. And then this man left. A very good man. He left. So he left, taking his medication. He called back, he sent in a note to appreciate the staff, and everything was going well for him. But the problem actually right now is that this gentleman has a relative who came to his home to visit him. And as they were talking, they were discussing, having some conversations. And one thing led to the other. The young man that came to the hospital said he would like to check his blood pressure. So he checked his blood pressure, and the relative who came to visit him also said, can I use your equipment? Can I use your machine to check my blood pressure? And then he agreed. I said, yeah, you could check your blood pressure. Yeah, of course, it costs no harm. Just check to make sure if you're okay or not. Then the relative checked his own blood pressure as well. And at that time, his blood pressure was elevated. So, this happened at home. And This man felt that, oh, your blood pressure is high. This is the medication they're giving me in the hospital that I'm taking. So, and the relatives say, please, let me have one of it. If I go to see my provider, yes, we can talk about this thing and they will address my own thing too. I will go to the hospital to see the doctor, they will see me. And out of not even thinking about it, the man that was on medication gave his antihypertensive medication to this relative. You know, the relative was never screened, it was never assessed, no prescription for him. But because relatives and they feel like, oh, your blood pressure is high, let me help you with my medication, and he gave it to him. So about 2 hours to that time, they spent some time together. He just noticed that this man was becoming weak and becoming dizzy. What's going on? What happened? Is it what you heard from here? Have you been sick before? What happened? Eventually, they got to the hospital, and lo and behold, this man has a very low blood pressure. So it was in hypotensive state. So luckily for him, he was given some fluid, he was resuscitated, so his blood pressure built up again, and over time, he was able to overcome that. So the bottom lesson here is this: if you were prescribed any medication, that medication is based on the assessment that was done on you, it's based on the findings, it's based on your own weight, it is based on your own age. Everything is calculated based on you. It is peculiar to you, it is specific to you, not for any other person. If someone is having similar problem or similar issue and you feel like, yeah, they need some help, not from your home prescription, please refer them to the hospital. You could call emergency line if something is going wrong and send them to the hospital. Do not be that good Samaritan to give your home medication, your home medicine to someone because you feel you want to help them. You may be causing more harm to them. So this man was lucky, came to the hospital on time, and he was resuscitated. And then they were both educated. They were both educated about sharing medication. I know you're a good person. You try to be good. You try to be nice, but no, not to this extent. You should know what you're doing. If you want to save someone, yes, please save someone. Save someone responsibly. Save someone with caution. Save someone with the intention that you want to save that person. Don't go beyond what you should do. Okay? That is that one. Never share your medicine with anyone. That medicine is for you. It was prescribed to tackle what is happening to you based on your own parameters, based on your own information. It is not meant to be shared with people. Please take note of that. I will share one more with you again. Maybe you've been traveling before and you see people getting involved in accident. You see people in accident scene. So you should try your best. Call the emergency number. Any trauma case like that, danger to that person, then you can extricate them. Do anyway just to get them out of the fire, or you feel that, oh, they'll be crushed on that road at that time. Try your possible best, okay, to take them out of that danger. But if not, if they are safe where they are, yes, it is advisable to leave them where they are until trained professionals get to that spot. Until trained professionals get to that place, just make sure that you leave them in that state. There are a lot of reasons to that, and I will give you an example of that. Okay, so an example of that is someone who was involved in an accident just like that, and in that process, I'm trying to hold a beat for the noise to go down. Yeah, thank you, my viewers. Yeah, thank you so much for joining this live show. Thank you for joining. I appreciate your presence. Appreciate your time. Time is precious. Thank you for watching. So, so I was talking about, as I was saying, so so there was an accident, and then people tried to help them. They see these people breathing, but for some reasons, after they got them out of that car, they noticed that one of them died on the spot. Like he just took his last breath. He first had some. Yeah, good afternoon, Madam Monique. So he first took some sharp breaths. They didn't know what was happening. So and that person lost his life. He died. So they didn't know what happened. This is what happened. When people got involved in any traumatic event like that, you try your possible best to stabilize their spine. If they have motor vehicle accidents, they have bike accidents or any collision, they fell or anything, don't just undo them anyhow. You have to stabilize their spine. Most importantly, the neck, the cervical spine. You know why? Every control, every stimulations, or let me say the warehouse, the big control that controls our body comes from our brain. And the brain is in the skull. That is our head. To pass those informations to the rest of the body, we need a connection. And that connection is from base of the skull, where you have your brainstem connected to the spinal cord. And at that level, if there's any injury to your neck, to your C-spine, cervical spine, and there is break in that communication, I'm sorry, we may lose all these vital structures. For example, the ability to breathe. You all know, or you all may know, that our lungs are down in the chest area. The two lungs, right and left, they have different lobes. We're not going into those details because this video is for everyone, not just for care providers or health professionals. So these, your lungs that are here, they receive their stimulations, their innervations. The control comes from what? Through the spinal cord, through your C-spine. Then it comes to the neck area and then spread down to your neck, then to your chest area where they are being stimulated. If the neck is taken off, no stimulation to your chest, your vital organs in your chest or down in the area. You can just have some spastic activity to your skeletal muscles, which are being generated from your spinal cord. And that one is really like non-relevant thing. Okay? So if anything happens to your C-spine, anything happens to your neck, you might be in a big danger if care is not taken. Number one thing you try to do to get someone out of those events, maybe they fell from heights, they had a collision, someone hit them, different things. Try to secure their neck. Secure their neck. So there are different ways you can do to secure the neck. If you do not have the cervical collar or the Philadelphia collar at your disposal, there are things you could do. You could roll up a rigid object, put one on the side, put one on the side, and then try to wrap something around you. You're not restricting the airway, you're not blocking the airway, but you try to immobilize the neck area, the head. So when you do that immobilization, the head will not shake anyhow to cause further damage to the C-spine or to the to the spinal cord. So let me put it that way, simple language. So when you do that, you help this person. Unless that person, if there's imminent danger to that person, please do not carry them anyhow. Handle them with care. You need to handle them with care. And that explains that first person I told you that passed out or that died during that accident. The person was breathing, talking to them, and immediately they dragged the person out, they mishandled the head of that person. The person took very quick breath, and then that was it. The person went off, and that was it. So they were surprised. Why did this person die? Because there's further damage to the C-spine, the delicate area, which has already been impacted because of that incident, because of the accident that happened. So protect the neck. Do not handle people carelessly when they got involved in any accidents. Call the emergency number. Call those people that are trained to come over and help these people out. That's the best thing you could do, unless there is an imminent danger, which will require you to quickly move that person away. If you see fire, of course, if the emergency people come to rescue that person, someone who is already burnt, they can't rescue anything. So please try your best and take them out that way. So that won't take more priority over you waiting for somebody to come and save, because the car is burning. Take them out. But if they are safe where they are, please leave them the way they are. All right, that is another one. Let's talk about another experience. Things people take for granted. So this person came to the hospital. He had a cut on his leg, or it wasn't actually not a cut. It was not a cut. He had a little. He noticed a little wound on his leg. He didn't even know how he got that, but he overlooked that, and he was thinking that, yeah, I could manage it, nothing will happen. So he went to the hospital. They told him, yeah, this is getting infected, and you have to be admitted and take some antibiotics, and we'll run some tests for you. We'll follow up with you. And this man said, I don't have time to do that. I'm working. I need to go back to work. I have a lot of people who are under me. I'm overseeing a lot of projects. I can't do that. You know that story. So this person is oriented, able-bodied man. You can't restrict him. You can't force him down. Trust me, this person left and he went away. So he was doing his dressing on his own, doing whatever he can do, managing to go to work. He was having some pain, and he was taking some pain medications to kill the pain. So he was only addressing the pain, but the problem is still right there. Please, if you are watching this, please help me share. Let others watch. Please help me share. That is one of the gifts you could give to me. Please help me share. So this man said, yeah, he's on top of it. So he believed, as the pain was being managed with all the pain medications he was taking, so he believed, yeah, everything is working fine. Unfortunately for this man, by the time he was represented to the hospital, they have to brought him to the hospital because he had become septic. And they brought him in. He was disoriented, different things happened to him. He doesn't even know where he was. So they brought him to the hospital. So he was worked up, and yeah, big sepsis. So treatment started. Eventually, he had osteomyelitis from that, his injury. And he already had some kind of dry gangrene, and the leg could not be salvaged. So I don't know why he waited for so long. I don't know. Probably he was reassuring himself, or he was denying that, yeah, it was getting worse. It will get bad. It will get better. I don't know what happened. But I tell you, when this man was presented to the hospital, yeah, it was bad. So the leg had to be amputated. He lost that leg. from simple thing to that big thing. Now, his life has taken a new turn because he's no longer having that leg, and he has a lot of regrets. But I'm sure he learned from that, and he's going to like tell people about his experience and advise them against what they are trying to do, which is not good for their well-being. So that is one thing. If you notice something strange in your body, you notice something is not well, you don't want to say, hey, I don't have time, because you don't have time now. I'm telling you, you might spend more than the time you're supposed to spend at this moment and later with more regrets. So it is better advice for you to create that time before time creates itself for you. You know, if you create time by yourself, you can still manage some things. But if people create the time for you, unfortunately, yeah, that might cost a lot. That might cost a lot. Please let us learn from that. Let us learn from that. Take good care of yourself and watch that. Thank you so much, Uluyemi Irinfolami. Thank you, Mama Ojo. Thank you so much. Thank you, everyone, for your comments. Please share this show. Let people watch. I'm just sharing the experience from this first show. So, other subsequent shows, subsequent live streams, we'll discuss more in depth about the little things, about my short videos I've been talking about. We'll go in depth to them, and I'm sure you will see something to learn from them. So let's talk about another one. I'm sharing experience over 16 years. So it's a lot. One thing again, another one to share. So this happened to a couple. They came together to the hospital, and trust me, one of them actually had a kind of STI. And of course, you know, STI, it's only one of them that had it. And the other one was clean. Okay. And education given, you know, at this point, they've already been having some quarrels, and they're like, yeah, we'll go there together, we'll have it together, let's see where it's going. Yes, they were together when the result came out, and so yeah, you need it. So educated, they were both educated, and you know, when you traditions, marriage, culture, practices, religion plays a lot of play different roles in a relationship. So for some reasons, the time they're supposed to abstain, stay apart, get treated, get things cleared, for some reason they came together. And then the wife was actually pregnant at that time before the STI event. So, and then they came together. Unfortunately, the woman became infected. She didn't present on time, or she didn't know. And for some reasons, eventually, she lost that pregnancy. That is one of the dangers of STI. It could lead to what? Loss of pregnancy. I hope you catch that. So this person lost the pregnancy, and she was so sad. And you know, she said, yeah, she can't deny the husband of his conjugal right. Yeah, that's why they had it. Then started blaming each other. No, it's not time to blame each other. You were both educated, and you just need to stick to the rule. And this is how it works. And I believe next time they know their tradition and also their rules. Sometimes you keep those traditions and you follow the golden rules to save life, to prevent unwanted events. And I believe from that, they learn something. So if you notice your partner is having an STI or something, yeah, you have to know what the person is having, and you should know the time you should abstain so you don't contract that infection. Let that person get treated, okay, let the thing cleared, fine. That is fine. And make sure when one party is being treated, you too have to get screened. Not that, oh, you're having symptoms, go to the hospital, you get screened and you get treated. You too, you might not be having that symptoms. Go to the hospital, get screened, let them tell you you are clean so that you will know that, hey, okay, I'm clean. I just need to stay on my own for a while before everything become resolved. So that is that one thing for people to learn. Another experience, a lot. So this day, someone came to the hospital and let me first say this. I don't know how to say it without opening up my mouth to say that. People who take substance, I hope you understand, people who take things, maybe things that will make them to become high, or things that will make them free from pain, or things that will make them, give them some crazy inspirations. I don't know. People who take things, I don't want to say it, you know. So those people, yeah, they are special categories of people when they come to the hospital. So someone come to the hospital with big complaint. He was vomiting, having nausea, you know, he was feeling nauseated continuously, and we're giving different things to stop all those events, and also pooping. And you know, you're vomiting, you're pooping, you're losing electrolytes. So, and we had to do all these replacements, everything done. So, and for some reasons, because of the cravings, of the substance this person used to take, he became so erratic, harassing people, misbehaving. We call the security to save the day. After talking to him, no, he wasn't listening to anything. He wanted that substance and he was requesting for some kind of pain medication. And he was given that, and he wants more, requesting for something else. So now, at that point, we told him what the rule is, and we told him how he needs to stay safe. So the safe way of doing things, but he wasn't ready to follow any rule. And eventually, he says he's leaving the hospital. We can't hold him against his will. Yeah, we can't do that. So he's oriented and he's of age. So this person left the hospital, and he left the hospital against medical advice because of his cravings, and he went to the streets. About 2 days later, someone found him and called the emergency number. Unfortunately, that was too late. It was too late. So he lost his life. One thing you should do, one thing you should know, one thing you should teach your children and yourself, no matter what you're going through, no matter what the situation is, no matter how hard things will become or may become, never you go near any substance. Never you go near all those things to calm yourself or to forget about your sorrow. Maybe you want to indulge in alcoholism, or you want to take any other substance, you know, the one that has COC, different ones. They are out there. Please, you need not to do that, because, yeah, they have grave consequences. They have things that is beyond your own control, because when these things start to act on your brain, if you don't see those things, you don't feel normal. I've seen a lot of them, so nobody has to like tell me, oh, you can do this. It is so difficult to get them out of it. It is so difficult to get them out of it. So always tell your children, tell them what fact about life is, and you too make sure you are a clean person. What they see you do, they will adhere to that better than what you do. you tell them not to do it, you are crazy. What you are doing, you are telling them not to do it, you are crazy. So the chances there that 50-50, they might do it, they might not do it. But what you don't do, what you do not do, what they don't see you doing, when you tell them do not do it, it will kill you, it will destroy you, it will mess you up, it will mess your life up. When you tell them yes, and you give them examples, you could go online, show them different things, they will see it there. Show them those things, the consequences of taking those substances. When you tell them, they will listen to you. And always ask them, have you ever seen me taking this before? They will tell you no. And then you tell them, this is why I don't want to take it. Because when you take it, it destroys your life. They can't concentrate in school. They can't concentrate anywhere. They can't think straight. They can't manage things successfully. Things that will be coming to their mind is about getting that substance. Some of them can go to the extent of robbing people to get money to get that substance. They don't want to go to work. Even when they go to work, they can't concentrate. They let them out from work. They get them out from work. They have a lot of problem, personality problem. They get angry easily. They don't think twice before they commit any crime. They don't think about any consequences before they do anything bad. So that is why you need not to go near those substances. And that is the exact way you will train your kids. What they see you not doing, it will be difficult for them to go and start doing that. But what they see you doing, and you are telling them not to do it, they will see you as a crazy man, that you don't want them to enjoy life. You don't want them to see things from their own angle. You don't want them to see the effect of that thing, that you are a liar. You don't want them to have that experience. But once you're not doing it, yeah, they will listen to you better. Okay? Don't go near substances. They're not good for you. They are not good for you. Let us leave that one. I hope you were able to pick something from that. Let us do this one. High risk activities. High risk exercises. You need to think twice. Think twice about the consequences of every activity you do, every exercises you do, everything you indulge in. Think twice before you do it. And this person has all these power bikes, and on the highway he was doing all these different things, riding, raising the of the bike, all those things. There was a rock. He's been doing that for a long time. He feels he's expert, but he forgot about the danger of that. So he forgot about the danger that could come after that. And on that fateful day, he was riding, doing his stunts on high speed on the highway. Eventually, that thing happened, and this person sustained serious injuries. He had multiple fractures. He spent months in the hospital to recuperate, series of surgery to fix him up, because he was on the highway. There are vehicles moving on his lane. He got thrown from the bike. Then he got a vehicle run him over. So he had multiple accidents. And eventually, whichever band, and whatever you do, please think about the consequences. Think about the consequences. You don't want to spend your life where you didn't plan to spend your life. You don't want to waste some time or some part of your life where you didn't intend to do that. So life is difficult even when you are able-bodied. When all your body parts are complete, life is difficult. Now imagine life when your actions made you lose some part of your body. Imagine that. So always be careful Assess every risk that you want to take. Before you take them, think about the consequences of every risk you take. Does it really worth it? Is this what you want to do? Are you ready to go under the knife to correct a fractured bone? Are you ready to become handicapped through your actions? Are you ready to bear those pain? Are you ready to lose your time, to stay away from work for some time? Are these things that you can afford? Is this what you plan for yourself? Think deeply before you do it. And this will guide your step. Think well about every consequences of your action before you do that thing. Okay? Let's talk about another one. This one is a diabetic patient. This person has diabetes. And some people have this notion that something must kill a man. Now you should tell them, even if something will kill a man, do not be an accessory to that. Do not help that thing that will kill you. If you want to die, die peacefully. Die well, not with some unnecessary things. Don't die in pain, Don't support that thing that will end your life. We need you here. For you to be living, some people are dependent on you. You might not know, not because you're giving them money, not because you're feeding them, but for them seeing you are their hope. You don't know. So, this person says, no, my blood sugar is high, I don't care, this one, I just have to eat. You just want to eat. And that's how he's been living. That's how he's been doing. He just wants to eat. Hey, this is too high. And let me tell you, in a week, minimum, in a week, he comes to the hospital with hyperglycemic state. Like in big hyperglycemic with ketoacidosis. And he has to go on insulin drip, get corrected, treated, discharged. He goes back again, mess himself up, come back to the hospital. Ignoring every education, diabetic education done for him with specialists. He's going to ignore that. He's not following the rules, he's not following these guidelines to help him get well and get better, to live a better life. He doesn't want that. Everything done to save him, to help him, to support him. Every support is there for him. But trust me, he's not ready for that. He does whatever he likes, and that is how he's been doing. If you are watching one of my short videos where I talk about diabetic retinopathy, yes, that diabetes is a stealer from you. Diabetes is stealing from you silently. You might not know. It's destroying your nerves. It's destroying your blood vessels. It's destroying your organs. You don't know if you're not managing it well. If you manage diabetes well, yeah, you'll be great. You'll be good. But now, if not, you are doing a big disservice to yourself. So it's a silent stealer. It steals from people. It steals your organs. It steals your body structures. It steals so many things from you. And same thing play out with this gentleman. He had neuropathy plus diabetes, and he didn't know that he had a wound injury, a wound on his leg, and that became infected, non-healing wound, because of course it's not even ready to comply with the medical advice to manage his blood sugar. The ulcer is not healing, became more and more infected, and he lost that limb. He lost the limb. He used the prosthesis to walk around. That has not even taught him any lesson. He still continue what he's doing. Trust me, yeah, losing his sight. Losing his sight. So, for some reasons, some people believe that what will be. I just want to enjoy life. I just want to enjoy things. I don't have to restrict myself of anything. Yeah, I have a God. Yeah, I serve this so thing that will take care of me. Nothing will happen. So that is what happened. Please take good care of yourself. There is a reason why we talk about periodic medical screening. At least once a year, get checked. Get checked once a year. During that screening, a lot of things will be revealed to you. If there's any reason to have a follow-up on any of your screenings or your tests, they will tell you, please come back in 3 months. Please come back in 2 weeks. Please come back in 6 months. Those information will be available to you, and the reason you have to come back, they will tell you. Okay? And during that revisit, we will assess again to see, is this something we have to monitor over time? Or is it something that we can close this case that no, it's not happening until next periodic check again? So, but a lot of people don't do that. We just leave. We prefer to look for money, get cars, travel, enjoy life, but you neglect your body. You leave your body out of the show. You have to take care of your body. And the way to take care of your body is to do what we call that screening, the test, the check. Make that check at least once a year. I also post on my other app asking that, when was the last time you visited your dentist? Yeah, I saw a lot of people laughing. Dentist, for what? My teeth is not paining me. I don't have anything, so why should I go and throw away my money? Yeah, a lot of things you don't see, a lot of things that is not giving you any sign. When you go to the specialist, they tell you this is what is happening. When they get everything checked, they check individual tooth one by one. They check them out. And some of them, you might need to get an X-ray, and they will do an X-ray of that tooth, and they tell you, oh, you have a cavity in here. You didn't know. Then you say, oh, serious? Yes. So you have to do that. Do periodic checks and check yourself out. That way, you prevent the bad day from coming. Okay. All right. Let me share one more before we go. I've witnessed so many things, seen so many things happening. And trust me, some people learn and some people are still not learning. So people taking what we call ATOH. So put it in your Google and just put ATOH. It will tell you that. Yeah, I don't know, for some reasons, I don't want them to give me any violation if I'm mentioning those things out. So this person actually takes that, drinks a lot. Yeah, you should have that clue now. Drinks a lot, so consume ATOH, and then there is this, he was having pancreatitis, abdominal pain, yeah, big one. And each time she eats, the pain comes. And with some necrotic areas, some necrotic part of the pancreas, like advanced one, with advice given to this person that, hey, refrain from this, do not do this again, treated, got discharged, come back the following week. Yeah, you have to stay away from all these things. Stay away from them. You feel when you drink, they give you some level of relief. They make you free from your trouble. When the effect of all those substances wears off, your trouble is not going away. So instead of you to find that solution to the problem, to sit down, think critically, that is the time you took that substance, and it will knock you off. You sleep, and when you wake up, trouble starts. You want to drink again to get the effect of your brain. You have to take good care of yourself. Avoid that. You need to avoid that. Avoid doing that. Don't do that. Don't do that. It doesn't worth it. You living in pain because of what you did to yourself. It doesn't worth it. It does not worth that. Please try to eat, take to medical advice, seek clarifications whenever you feel things are not clear to you or you don't know what they ask you to do or why they ask you to do something. Ask questions. Prepare before you go to the hospital with those questions that may be that may be bothering you. Get them ready before you go. Get prepared, and you should see that encounter as a way of knowing more about yourself and also your provider too. Please take good care of yourself and don't neglect any symptoms. Any strange symptoms, do not neglect. Thank you so much for watching, and please share this video to others so they could watch and learn one thing or the other from here. Please share this channel to people, recommend for them to follow, and we will do more about all these talks, more and more and more. Thank you all. If you are watching this video for the first time, you see me for the first time, do not forget to hit that subscribe button. Please subscribe and follow this channel. If you have any questions, you need any clarifications, drop them in the comment section. When I go through them, I'll see them and respond to you. Thank you so much, and have a blessed weekend. Bye, everyone. Bye. Thank you, thank you, thank you. Bye.